Our service area for St. Mary's and Clearwater Valley Hospitals is 3 counties. Idaho, Lewis, and Clearwater County are very remote frontier counties. Because of our geography, a lot of our patients are socially isolated. So they don't come to our clinics, they don't access healthcare on a regular basis. And we find that if we're able to help connect these people to resources, we're able to better help them manage their own health. Bridging the Gap is a 5-year grant initiative funded by the Merck Foundation, and it looks at creative ways of tackling diabetes within our communities. We're not just looking at the medical needs, we're looking at all of the needs of the patient. So behavioral health needs that affect the disease, the social needs that affect the disease. We look at it as a comprehensive plan to attack diabetes that is not just focused on the medical aspect of the disease.
I am a community health worker for Clearwater County, and I go out into the community and assist with screenings and connecting people with resources.
Community health workers play a huge role in our organization in that they interact with individuals in the community who can't get within our walls to actually seek the care that they need. So the community health workers get out there and take the care to them.
A lot of the patients that we see in the rural communities may not have transportation to and from their provider, or just generally being able to afford to provide the gas to get to the provider. So we also do one-on-one in the clients' homes where we can go in and assist with food insecurities, or if they have medication concerns that the providers would like us to kind of address. And at any given day or week, it might be over 200 miles that we are commuting to see these individuals.
In addition to one-on-ones, our community health workers developed community health walks to offer our patients an opportunity to gather, to discuss issues that they're having, to share stories, and to also get exercise, which is a huge proponent for overcoming diabetes. When we screen our patients, we have begun to notice that a lot of them have food insecurity issues. That led us to partner with the Idaho Food Bank. We co-locate services, which means we send our community health workers to food distribution sites, offering services, offering screenings, at the same time that they're actually receiving food.
My role as a dietitian here is a little different than it would typically be with other roles as a dietitian, because I get to have a community health role as well as a clinical role. With our patients, most of them don't even recognize that nutrition plays a role in their diabetes. The Bridging the Gap program allows me to meet an individual with diabetes and offer them a service that they typically wouldn't be able to have.
We don't do work just to check boxes. We really want to make an impact on the people we care for. Working on the Bridging the Gap project is very exciting because there are so many opportunities for us to push the envelope on the type and the quality of care that we are providing for our patients. Because we collaborate with partners, because we get out into the communities and we work with these people directly, we're having a much more profound impact on our patients' lives than we ever could have if we just stayed within the walls of our hospitals. I believe it's very valuable that our project is 5 years long. We are 2 years into this, and there are still things that we are learning.
I'm just really proud to work for our clinics. Watching them, give us the ability to go out into the community and make a big difference has just made me so proud to work in this environment.